Welcome to the Good Day at Work podcast. I'm your host, Vikkie Buxton-Cope.
And I'm also your host, Ben Moss. In this podcast series, we'll be exploring the nuances of workplace health and wellbeing through a series of conversations with those who are out there helping to create good days at work within their organisations.
So, what makes a good day at work? Let's find out. Sarah Jackson is a consultant in occupational medicine. Sarah joined the British Army whilst at medical school at the University of Newcastle-upon-Tyne, initially training as a GP before completing her training in occupational medicine in 2010. She has served in Canada, Bosnia, Iraq and Cyprus and left the army in the rank of Lieutenant Colonel. Academically, Sarah completed an MSc in occupational medicine with the University of Manchester in 2010 and a PhD with the University of East Anglia, was awarded a fellowship with the Faculty of Occupational Medicine. She joined EDF in October 2018 and in May 2022 took over from Dr. David Brown as the Chief Medical Officer for EDF. Sarah chairs the Nuclear Industry and Ionising Radiation Occupational Physicians Forum and the Health and Technical Committee for the Energy Institute. She is a committee member for the Energy Network Association, whose recent constant in Jersey, Ben Moss, who's with us today, recently presented, and we might touch on some of these aspects as we go through the discussion today. So welcome, Sarah. Thank you so much for joining us today on the Good Day at Work podcast.
Oh, thanks for having me.
We're really excited to have this discussion with you. Obviously, Robertson-Cooper have got quite a long-term working relationship and partnership with EDF, which I'm sure we'll kind of touch on today. So we're really excited to kind of bring your experience to our podcast listeners today. So if you don't mind, we'll crack on. We'll get straight into the discussion. And we just thought we'd start a little bit before launching into your kind of current role and the things that you're doing right now, and talk a little bit about your background and journey into the field of health and wellbeing. So if you could just tell us a little bit about your journey to getting to EDF first. So you're kind of more on the training medical practice, and obviously we've talked about your army experience there. It's not your average route into the world of workplace health and wellbeing. I'm sure it's not one shared by many. So yeah, just interested to hear a little bit about that, Sarah, if that's okay.
Yeah, so I joined the army. I always knew I wanted to join the army even before I wanted to be a doctor. I think I'm a bit of a tomboy, so being outside, getting fresh air always appealed to me. But actually army medicine was absolutely perfect for me. And in terms of occupational medicine, the big difference about the military is every doctor in the military practices occupational medicine. They have to think about the duties of a soldier as they're treating their patients, whether you're an orthopaedic surgeon, a psychiatrist, a gynecologist. And so it really gave me the exposure that I needed to workplace health. I think also the experiences that I had in terms of the places I worked. So in Canada, for example, I was the doctor manning a helicopter for when it went wrong. We were on exercise, so pretending to be kind of in conflict. But when real accidents happened, then I would be flown to the site and I'd have to pick up the casualties and take them back to the local hospital and obviously then, treat them and look after them after that. So I think that was, my first kind of awakening of the fact that really we don't want people to get hurt unless it's conflict. We don't want accidents to happen. So the health and safety aspects of work really came to the fore in that particular role. I think in terms of the other jobs that I did, the conflict in Iraq was a huge eye opener for me in terms of we had to all be fit, we were all physically ready to go and potentially serve somewhere where we would see really significant casualties. But it was the mental health aspects that I hadn't quite really understood in terms of however resilient you are, it's really frightening going into conflict. And as the doctor, you are the pillar you're looked to, along with a role called the padre, which is usually a priest or a vicar, or it can be other denominations as well. And they're responsible for looking after the spiritual side of the soldiers. And you suddenly find that even the most senior people are coming to you with real anxieties and real worries about, kind of what might happen. And really, you don't have any answers because I didn't know either. But you're absorbing all of this from everybody and trying to manage it yourself. I think what then started to become clear to me was that the type of leadership that you had in those conflict situations was absolutely essential. And there was a really good research article done years later, years after I'd been in Iraq, where some of our army psychiatrists went to the front line in Afghanistan, and they did some questionnaires, and they did questionnaires looking at leadership styles and common mental health disorders, and they found that people who had a leadership style where the soldiers felt they really believed in them, knew them, cared about their families, were much less likely to be suffering or feeling, some of the symptoms of common mental health disorders. And I certainly saw that in Iraq. The leaders who were empathetic, who really knew their soldiers, who understood that their soldiers were scared and let them be scared, really had much better outcomes on the battlefield than leaders who perhaps didn't have that empathy. So starting to see kind of, I suppose, the nub of what we're talking about, well-being at work in action, and how that actually directly correlated with success. And I trained as a GP in the army, so again, being a general practitioner is a great background for occupational medicine because you get general medical background, but also you see the other side of the coin. You see people coming to you where they're having a really tough time at work, and maybe work isn't responding in the way that you'd want them to. So then when you flip the coin and you become an occupational health consultant, actually that person's, it takes a lot for them to come and see you as an occupational health consultant, and that's probably a different face from the face that the GP is seeing, and it really helps you understand where that patient's coming from. And a lot of what we do in occupational medicine is really sort out some of the issues that we look for in occupational stress surveys. So where relationships at work are poor, or workload is high, or there are other problems, I always say we bring out the elephant in the room, because we can talk to people in a medical in confidence arena. Quite often they tell us what's really going on, and we can then expose that with their permission, of course, and start to move the issue forward. So landing in EDF was the right place for me, really. Very safety conscious, very, very committed to health and well-being, and it's been a great journey starting to really see these things put into practice.
Yeah, I mean, it's such, when you think about the environment that you came from, you think how different that must be in terms of a kind of a setting, a work setting, but making those links that you've made there about, health and safety, and kind of how you want to keep people safe, and how mental health, the kind of elements of mental health coming out and how important that is, that leadership piece around that kind of impact that has on the outcomes of the team. All those things absolutely are things that we talk about, don't we, in corporate daily well-being life. So it's kind of, yeah, I mean, there's obviously massive kind of transference there, but how did you adapt though from kind of being out on that field, the stuff that you talked about with the helicopters and whatnot, kind of, it must be very different day to day, even if some of the issues might be at the core quite similar. How did you adapt kind of going from that environment into more of a corporate life after active service?
It's a really big shift, and one of the biggest shifts is your attitude to risk. So in the military, by nature, what you do is take risk. That, conflict is risk. That's exactly what it is. Moving to a corporate environment where you don't take risk and you don't need to take risk, and you can stop whatever you're doing to control that risk, for me actually was a bit of a breath of fresh air, because I think one of the things the military struggle with is, as leaders, they have to train to take risk, but really we don't want them to take the risk on exercise where they don't need to take the risk. And being able to flip-flop in between the risk-taking, not risk-taking, is really, really challenging. So it's a little bit of a breath of fresh air being in an organisation where actually they don't want you to take risk. They don't want their people to take risk, and they really support people genuinely. Because I was a bit enthralled as to whether, when I really started with EDF, would they really be that, that supportive of people saying, I'm not doing this job because I think that this isn't safe? But the answer is they absolutely are. So for me, things like, I travel quite a lot with work. In the military, quite often it would just be expected that you drive late into the night, get up at early doors. EDF much more controlled, and again, for good reason. They're different employments, they're different, kind of organizations, but yeah, they do really prioritize, people's safety, and that's a real breath of fresh air, because when you talk about well-being, they are really trying to understand well-being. They're not just paying lip service, as I think a lot of organisations are at the moment. They're really trying to understand it and understand how they can get better. And I think we're finally persuading the world that well-being isn't something that's pink and fluffy and has no evidence base. Well-being does have an evidence base, and you can create a strategy that will really make a difference, but it has to be really the hard things. We know that well-being, to really change well-being in an organisation, it's not a quick fix. You have to go after the really hard things, and EDF are doing that.
Well, I guess the thing is that risks are much less obvious in the corporate world. They're still there. They're all around, but it's much harder to pull them out than in a military setting where it's the clear and present danger type of thing. But in the corporate environment, it's more about that sort of constant vigilance, where the new risks are coming from, creating that culture where everybody's looking for them. But they're actually probably quite a low level of awareness at the starting point for that.
So I think it's the other way around. I think EDF have a really high level of awareness, particularly on the nuclear side, where, actually everything, every time they do a job, they have what we call a pre-job brief, which is where they go through what they've got to do on the job. They look at the risks, they highlight the risks. Every time they finish a job, they have a brief afterwards to understand, were they the right risks? Did they get them right? And because of the attitude to like kind of nuclear safety and security, it's ingrained in everything they do, in a very different way from the military. And that's been really, really interesting to see, but also challenging in another way, in that, in the military, if you needed to go fast and quick, you could, when you're controlling risks really tightly, that's not something you can do. You have to be methodical.
Yeah, well, I guess psychosocial risk and physical risk play differently in both of those environments as well, don't they?
Yep. Absolutely. But it's interesting trying to understand, I think we're now at the point where many organisations are starting to understand that, health and safety has always been lumped together. It's never felt like it fitted together. Health has always been over here, safety over here, like never the twain should meet. And I think there's a realisation dawning that well-being is in the middle of all of that, and it absolutely links health and safety. And a bit like what we were saying about the the leadership in Afghanistan, if you've got people who are good leaders and their people have good well-being, I think it's highly likely that that will correlate with lower safety risks. And we've got some evidence of that in NHS literature, where people who haven't slept, or people who are feeling particularly stressed, have made things like drug errors, etc. But we haven't got much of that in the rest of the safety literature, and I think that's where the research will be going, which is absolutely fascinating, isn't it? Because that's starting to make well-being really imperative to everything that you do at work then.
Yeah, exactly. It totally disregards it as the pink and fluffy stuff when it's kind of articulated in that way, for sure. But I think the research definitely helps, because I think there's there definitely was that cynicism, wasn't there? It's yoga mats, it's smoothies, and all these things have their place, don't they? But I think more and more it's less about kind of convincing organisations. It's just helping them translate it into their organisation in a way that makes sense and connects to the wider strategy.
And it's something tangible that you can do, because again, for a lot of time, well-being was just this thing over here. You couldn't really measure it. You couldn't really decide whether you'd improved it or not, and so people paid lip service to it, really. And as you say, yoga mats, constantly what we see a lot with wellbeing strategies is they're written by a group of people in the organization, often HR, often female, although that might work for more female-based organizations, but they're the people who really believe in it. So they're writing a strategy that they can buy into, that they participate in, but actually the rest of the organization aren't. And I think that's something nuclear operations specifically in EDF have really worked hard to try and make it relevant to the people out on a nuclear power station in a boiler suit turning valves, rather than something that only the people in the offices with access to their corporate IT can take part in.
That is absolutely so important, I think.
And differentiating as well between a strategy and a plan, because I think quite often people write a plan and call it a strategy, which then leads to lots of initiatives, but no sort of underpinning,
don't join up,
philosophy or data to join it all together. Yeah.
People want quick wins, don't they? So people want quick wins in terms of they want to be able to buy something in and it fixes everything overnight. And actually what we know with wellbeing, it's the strategic approach, having this line of, okay, we're going to explore, for example, culture, and we are going to look at what aspects of culture are poor for wellbeing, and we're going to then try and change those. That's not something you're going to fix in 1 year, 2 years, probably even 3 years, maybe 5 years might be realistic. So you have to have that strategic, long-term, kind of approach to really achieve the greatest gains, I think. And that's something that a lot of companies still haven't really got their heads around.
Yeah, I think there's barriers to that, aren't there? Which often start at the leadership level, and it is about wanting expediency, wanting results. The initial, I guess, push to start something like that being triggered by a bad set of numbers somewhere, and wanting to change that set of numbers quickly. But actually, as you say, the easiest route to it is not necessarily the most effective, or is seldom the most effective.
We've started to get into the life at EDF, which is absolutely fine. It's what we're here to talk about today. But before we get into it a little bit further, Could you just give us a little bit of an overview, Sarah, of EDF? Just obviously we work with some of the business units inside the group, but I think it'd be useful for listeners just to hear a little bit about EDF Group, about kind of the journey that you've been on really in terms of kind of before we got to where we are now.
Yeah, of course. So obviously EDF, large energy company, helping Britain achieve net zero, which is, really important, isn't it? And getting more important by the day. It's a really interesting company. It's French in origin, has lots of kind of nuclear assets in France, but in the UK, has quite a large business that spans renewables. So lots of wind turbines, battery power, really exciting projects looking at how we can create energy from different technologies. We've then got our customer business, which is call centres, trying to look after the customers. Again, very interesting in terms of the demands on people doing those roles. And you can imagine during the, the height of the energy crisis, when people were feeling really desperate and quite fed up with the energy sector, those customer service guys, or energy specialists as we call them, really, really tough jobs, but amazing in what they do and how they look after our customers. Then we've got the nuclear ops business, obviously, again, nuclear power stations. Interesting time for us in that many of those nuclear power stations are now coming to the end of their life, and we're looking at handing them over to defueling and decommissioning. And then EDF has stakes in some of the new build structures for nuclear, so Hinkley Point C and Sizewell C. And I should mention, in the customer business, we also have our field operatives, who are also the guys that go around and fit the smart meters and do all the kind of meter work, which again, incredibly challenging. And during COVID, thinking about those guys going into people's homes, they were incredibly brave and stoic, and kind of made sure that people were connected all the time. And we have a corporate centre, obviously, who look after all those business units. We also, in occupational health and EDF, we look after another business unit, which is an EDF group, which is a company called Dalkia, which is kind of facilities, engineering, low-level construction work. And again, just absolutely fascinating in terms of the varied work that they do all around the country.
So kind of really different employee populations quite across that.
Quite a big company, but really trying to one of our visions from our leaders to try and work together and benefit from the other business units. So strive together to be the best at what we do, and that's a really good kind of principle, in that we learn a lot from the other business units. So providing occupational health across all of those, quite often we can share with business units, actually, this is what they're doing and this is really working, or think about this approach. And we get together a lot, particularly in the health and safety space, to talk about that, because whilst the jobs are different, people are largely people. So we can apply some of the principles, and at the moment we're looking at kind of well-being training for managers, so to try and help managers have meaningful conversations, help managers understand well-being and understand what levers they have to try and help when people are struggling. And again, that's been very powerful, because we can do that as a whole business together.
Absolutely. It must be quite key, I guess, when you've got such different employee populations, but also quite distinct business units that do operate, don't they, quite autonomously and independently in some ways, to try and give that kind of ability for them to do that, because that gives them that authenticity. They understand their populations and they have that autonomy. That's great in terms of their approach, but having that kind of standard, that consistent standard across the piece, is quite a challenge, I guess, when you have that going on. So I guess it's quite a helpful thing to do, to bring something in across the group.
Yeah, exactly. And it's not necessarily about all doing things the same way, because each business unit is different, and what might work in one might not work in another, but it's having the same principles, so if you like, the same strategy underlying it for why you're doing what you're doing. And that's quite impactful. And we found that in COVID. COVID really taught us as a business the gains that we can have from working more together. So even though we had different kind of testing approaches, different track and trace approaches for the different business units, the principles that underlay those decisions were all the same principles, which makes it easier for everyone to understand why you're doing what you're doing.
And in terms of culture then, do you feel like you have an EDF culture, or do you feel like that differs quite a bit kind of in terms of the different business units? Or just interested, because kind of quite a lot of businesses sometimes find that quite challenging, I guess.
I think EDF, as a brand, has a strong, employees feel a strong affiliation with the EDF brand and what EDF is as a company and what it stands for. But I would say each of the business units have slightly different cultures, just because the natures of what they do is different. Team structure is different, how they work. Again, thinking nuclear ops, they're not really sat on laptops. They're out, on a plant. So the stations have quite strong identities themselves, even within the nuclear ops group. And if you think about field, the guys are out working quite remotely, so they're not necessarily feeling in a team in the same way that you would do in the call center teams. So they are quite different cultures, and I think understanding that is absolutely key on my part to advising them, but also to understanding what the strains and the stresses might be, because they are different in each of the units.
What are those constants then? What are the constants that go across every, that come from the centre, the core values, if you like? How would you summarise those?
I think in terms of EDF really values its people, and I've seen that time and time again in that the willingness to invest in people, willingness to look after their health, willingness to kind of obviously make adjustments at work or support people at work. And I think that for me that runs throughout the business, that belief in their people, and that's quite key, isn't it? It goes back to that research in Afghanistan. If people really believe that the company is going to look after them, then it's a very different employee experience. I think trying to be innovative and trying to use what to improve kind of the employee experience as well as the customer experience is something that runs throughout the business. I think the feeling that we are contributing to sort of something big in the UK. Everything I read about the energy sector, and I am definitely not an expert, but we are in trouble in terms of we don't have a huge amount that we can do apart from oil and gas, unless we start to expand the nuclear and the renewable capability, and EDF plays a huge part in that, and that's quite exciting, and people feel that. Even if you're not necessarily on the energy generation side, if you're on the customer side, you're advising customers about this every day, and trying to build their confidence in us as a company that will do the right thing.
Yeah, and that sense of purpose piece is so important, isn't it? I mean, we know we talk about good days at work, we talk about sense of purpose quite a lot, but I suppose that purpose and meaning for your employees comes both from that, like you say, people in the call centres in the cost of living crisis and the energy crisis, like feeling that, in terms of the impact that it's having on people, but also that wider societal piece. It's a big thing. It's a big news story, isn't it? It's there every single day. So feeling like you're doing something and working on that, and part of that must be something that's quite consistent across the group, even if the roles and areas in which you work are different.
One of the strap lines, in our safety kind of culture is, do the right thing even when no one's watching. This isn't about, being seen to do something correct. This is about, really keeping everyone safe at the heart of what you do. But doing the right thing is also a theme that runs through the customer business, in terms of when we had, the energy crisis. EDF was working really hard with all the charities and all the people supporting, the customers who were in distress, to really try and make sure that we had a package in place for customers who couldn't afford their bills, and we, did our best to absolutely look after vulnerable people. And the energy specialists feel that. They know that the company are doing everything they can, and again, that sense of purpose runs throughout, even though it's slightly different aims.
And did you find you had to support those, particularly that employee group who were at the coalface during that time? Did you find you had to kind of almost provide a different level of support for them, in terms of, they must have been having, especially the number of conversations that they must have in a day, and here, and I think it's, you hear, don't you, from call centre, you hear all sorts of things. It's not necessarily just about the price of the energy bill. They're probably going to get everything that's going on in that person's life, just like a manager does in the day to day as well. So I guess, did you have to flex anything around the support for that?
Yeah, the customers business were amazing. They trained up their managers to understand how to support their people. If they'd had a bad call, they could sit out for a bit. They could go and talk to somebody. Our health nurses are embedded within the business, so they could go and talk to one of our OHAs if they were really struggling. But actually, the managers dealt with a huge amount of it. Just from having the understanding, and sometimes a peer support network is incredibly powerful, because they can come and talk to me, but I won't ever understand it on the same way that another colleague would, and so they really did manage that extremely well, which is wonderful to see from my point of view, because that's what you want. You don't want you want things to be dealt with at the lowest level possible. If somebody's distressed, if you can deal with that then and there, rather than it escalate and they really struggle, then you're going to get much better outcomes.
That peer network is it in action then, isn't it? Because it is that, if it's day to day and it's that high volume thing, you're not going to talk to a manager about it, talking to your partner at home about it, it can be, I'm sure it felt quite relentless and quite, you probably felt quite ill-equipped, I'm sure, in some of those conversations and things. So to have that ability to debrief, get it out, have those kind of things in place in the moment, sounds like it was really important. Sorry, Ben, were you gonna?
I was just going to say, I guess that part of the business must almost feel like an entirely different set of capability that it has post-COVID as a result of going through that journey, because you go through something like that and you solve all the problems that you need to solve to look after each other and the customers through that piece. You're almost in a different culture at the end of it. That must be really gratifying, but I guess the rest of the business can learn something from that as well.
Well, and also our customer business is going through quite a big change anyway in terms of their operational model and the software that they use. And that's seen a change into much more team operations. So teams have they keep the same customers, they look after all of those customers within that team. They work very much as a team, so they tag team it if there's tricky problems to solve, etc. And actually that's been very, very well received as well. So lots of rewards, lots of recognising hard work, lots of recognising the challenges of being an energy specialist. And everyone I've spoken to who's crossed over from the old system to the new system has really enjoyed it and really, likes that team-based working. So again, more learning, I think, from, everything they've been through the last few years.
Just to take it kind of a little bit up a level, I guess. We talked a bit about the structure of EDF and the culture and how that, and kind of operations and that side of things. Can you talk us a little bit about how well-being is owned, if you like, how it works? Because I think there's something often that comes through with clients is that many different roles might own it, kind of from business to business, organisation to organisation. Often there's not a clear or shared understanding, and across businesses, or sometimes it's completely siloed and hidden away somewhere, and isn't. So I think, it's often really helpful, I think, just to hear a little bit about how that works for you and how, so where does it sit, how is it owned, and how do you influence around it, I guess? What are the key roles?
So we have a health and wellbeing leadership team, and I chair that, but it consists of all the leads from each of the business units, but also the central wellbeing team, which sit under our kind of health and safety director. And what we agreed is that we would come up with a central strategy, a corporate strategy, which interestingly we wrote a few years ago. And when the World Health Organization released their strategy for workplace health, it's almost exactly what we wrote. Not saying that they copied it, but it shows. I know, I'll go for it. It shows that the evidence base that we all, that strategy came from looking at the evidence base. So it was very reassuring to note that our strategy was effectively exactly, what they then identified. And I think the intent is that the centre will kind of keep the strategy. The business units will apply the strategy as it's relevant to them. So each business unit is at very different stages. Some of our businesses are very different stages of maturity. So obviously you're not going to address wellbeing straight off the bat if you're a new company. You're going to start by kind of getting your HR system in and all the, the bones of kind of getting your company sorted. And then you're going to get into the more advanced wellbeing strategy whilst being aware of the dialogue. So when you are buying in systems or kind of, plans or strategies, you can incorporate that into the business as you develop it. So it's certainly not a 3-line whip to follow exactly what's in the corporate strategy. We set out the evidence base and the best practice, and then the business units aim to achieve that in a time frame that's appropriate to them in a way that's appropriate to them, if that makes sense.
Absolutely does, yeah. I think it's really important, isn't it? Like, going back to that kind of central versus local thing again, I guess, but it's to have that consistency of, what is it, first of all, as well, because I think that's the other thing. It can mean absolutely different things, can't it, to different people. What do we mean by it, EDF, but also, understanding that and giving that autonomy to kind of to do that at the business unit level is obviously, really, really good. Obviously, you guys have adopted the idea of good day at work. So, a little shameless plug for ourselves there, I guess. But you guys, I think, out of many of our clients really have wholeheartedly taken that inside the organisation. So just, it'd be useful just to talk a little bit about why is that idea important to you and EDF, and, just your kind of reflections on how that feels inside the business.
So interestingly, at the beginning, you mentioned, that I did a master's in occupational medicine, but actually that research as part of that was in occupational stress, and it was looking at obviously the literature around occupational stress, but also like a kind of a piece of prospective research looking at whether occupational stress levels of recruits as they entered training influenced their outcomes, which it did, albeit you can't say it's causative, obviously, because it's, we didn't control for absolutely every other confounder, but it starts that understanding that actually, we do have a duty to manage stress in the workplace. The HSE make it very clear in their stress management standards that the duties of employers is to look at the stress in the workplace, to understand it and to try and reduce it. They're not saying you have to be perfect, but we do have a duty to do that. I think with the work-related mental ill health rising and mental ill health generally in the population rising and leading to really significant worklessness, particularly in a younger population, I think the kind of regulatory pressure on that is going to increase. And what I like, one of the things that I think a lot of people don't understand is, you can't just ask some questions. You can't just throw some questions together and say, I've measured stress. Just like you can't, get a Bunsen burner and boil some chemicals together and say you've had a chemical reaction. You have to know what you're doing. And I think a lot of people, because we all kind of have a very basic level of psychology, I think a lot of people think that it's that simple, that you just throw some questions together and there you go, that's your stress survey. And actually, certainly from my master's, what I came to understand is actually the creation of a survey that's valid is actually quite hard, and you have to put questions together in a particular order. You have to test that answer, because what you want to know is that when you get somebody who says my demands at work are too much, that they really are too much. It's valid. It's not just somebody who's answered a question in a particular way because you wrote a leading question. So for me, a lot of organisations don't understand that, and certainly within the business, a few of us have had to educate people to help them understand that we need a validated survey. It has to be valid for it to be useful. What I really like about the Good Day at Work survey is it goes beyond just the validated stress survey. You look at other factors that might influence how people feel at work. So, for example, resilience is bandied around a lot, and resilience training, all of which I think a recent CIPD result, kind of review showed really isn't very effective. Resilience is a thing, but it's often internal to people, and to train it is quite hard. But actually understanding how you are as a person and how you interact then with the job demands is really important. So having that in the Good Day at Work survey, it for me is absolutely fantastic. But then you pull it through to outcomes for the business, intention to leave, productivity, and we've started to add in, haven't we, some questions on presenteeism and absenteeism. And this is all absolutely key, isn't it? We need to make sure that we help the organisation make those links between actually, if you're a very resilient person, but actually your job demands are way too high, what does that mean? And how does that link to your productivity, your intention to leave, your advocacy for the business, etc. So for me, it's a great survey because it does the valid part that we need to do, that the HSE says we need to do, and the regulator's probably going to start checking that people are doing in the very near future. But also it starts to pull through to what does it mean for the business, and that's very important for the business, understanding why you're doing something. And so for me, the first start of any bit of research or intervention is understand your baseline. And that, again, the Good Day at Work survey lets you understand your baseline before you do interventions or before you develop stuff, and you can then see what actually works and what doesn't work. And that's a bit of the literature that's missing, isn't it, in wellbeing, is, if you've got a big change program and people are feeling the strain, what does work when they're feeling that strain? So there's still plenty of work to do. You mentioned there, Ben, the panacea. The panacea for me is not as an occupational health doctor waiting till somebody's off sick. The panacea for me is to have some kind of marker, predictive marker, that lets me look and say, I know this person's now struggling for whatever reason. We can now offer them support at the point where they're struggling before they get to the point where they're really falling over. And a really good employer, will hopefully start to strive towards that, that panacea of getting to people ideally before they even know they're in trouble. At the point when the markers are there, can we get support in place so that nobody has a really bad day at work?
Okay, so we talked a little bit about the importance of the data-led approach, and obviously EDF do that really, really well. It's at the kind of heart of everything you do. Can you tell us a little bit about how you use that data, Sarah? I think, one thing that we often talk about with clients is almost that there's sometimes even too much data these days inside organisations, and it's actually coming, especially HR, but, health and safety as well, and all those sorts of roles that rely on it, but it's coming from everywhere and they're almost overwhelmed and don't use anything well. So I guess if you've got anything to share in terms of how you kind of best use it, really, how it helps you guide your approach, and any lessons learned really around that sort of stuff as well, would be helpful.
It's really interesting, isn't it, with data, because we were really data poor at one point, and now everyone really has realized the importance of data, but then you flood your business with data that actually, if you're not trained to understand what's good, what's bad, and how to use it, it's entirely useless. So we actually have a data meeting once a month, and we have had some analysts who've been able to join occupational health and sit behind the medical and confidence barrier and marry up some HR data and occupational health data, which means we can do not just the usual looking at sickness, absence, causes, trends, but we can start to look at, the cases that we're seeing in occupational health, the numbers we're seeing for mental ill health, any work-related ill health and what that looks like, and how that, how that might be important. And where the Good Day at Work survey for me comes in is, you're telling a story, aren't you, with your data, and you need to be very careful about how you present that to the organisation to help them understand that. So for me, the Good Day at Work surveys are leading data. This is how people are feeling right now, what that looks like. And then we're following that through and looking at, does that translate to occupational health, contacts? Does it translate to some increased scoring in our common mental health disorders, because we use common mental health disorder questionnaires, validated ones, as part of our medicals. And then we look through, does that follow through to sickness absence? And, the aim or the hope, I think, is to start to get some of those data available for safety as well, to start to see how those all correlate and how they link together. And once you start to understand a patient's journey, perhaps from feeling great, having a good day at work, to actually not feeling so great, not having a good day at work, for whatever reason that might be, whether it's work related or whether it's because of outside work causes, and whether they then come into, needing support through occupational health or then into sickness absence. Understanding that journey is going to be absolutely key if we want to get to the panacea of predicting who's going to struggle. I think with data, the piece of advice I would give organisations is, don't just put it all out there. You have to think about what is quality data and what is not quality data. Quite a lot of kind of surveys that businesses have traditionally used aren't validated. So while they might be useful to look at employee engagement or other markers, you don't probably want them mixed in with your health and wellbeing data, because they might give, a non-valid kind of impression, or take the reader down a wrong route, if that makes sense. So I think being really clear with what data you've got, and then thinning it out so that you've got the quality data accessible to the people who need it, who can interpret it, and talking those people through how to interpret it. For example, if you think about EDF and our business units, some of our business units are really small. So you might get a massive percentage change in sickness absence, but actually that's because it's a very small business unit and they've had 2 longer term sick cases. So you have to have people who can understand those parameters of data in order to interpret it. But for me, the Good Day at Work survey, starts to give us that front end data to say who's struggling, why are they struggling, and is that pulling through to sickness absence or people needing support in the workplace.
And you talked a little bit earlier about kind of coming to the focus on leaders and managers in this area. What kind of role do they play in terms of helping you manage health, safety and wellbeing at EDF? So I'm assuming that because the data obviously gets disseminated quite extensively throughout the organisation, how far does that go, and how does that interact with leaders and managers and their roles in taking that forward?
So thinking about the Good Day at Work survey, one of the brilliant things about that, and interestingly, I've just done my feedback to my team on our Good Day at Work survey. So I've seen it from a strategic level, looking at the business, but also as as my relatively small team, and how that's helped me. And the ability to give leaders meaningful data on their group that's relevant to them is really, really useful, because each group is slightly different. And therefore I think that's why a lot of the kind of bigger surveys, like I think mine did a big survey, they kind of fell flat, because it's great having kind of business level data, but actually as a manager that doesn't feel relevant to me. It doesn't feel like it's actually getting to the nub of what my challenges are. So I think having data at that level is really important, but you have to help managers understand it, and you have to help managers understand what their levers are to help with it. So, for example, we've had a lot of change in EDF. Job security and change is something that people can feel a little bit wobbly about. So thinking about, okay, what can I do about that? What can I do to help read them into what the strategy is, where the business is going, so they feel a little bit more reassured about change and where it's going to stop and where it's going to start again. The health data, again, we have a kind of a software that means that people can go in and they can cut the data how they want, and we've given access to that to our HR people and to our occupational health people. So kind of occupational health data, common mental health disorder data, sickness absence data, and we've all given them all training talking through about how to think about those data and what things to look at. And the aim really is to get them looking at those data as a group, as a relevant size group on a regular basis, so they start to understand their own trends, understand their own baseline, and can then see their own changes. Because again, data's not going to be that useful if you only look at it at company level. It has to be looked at the functional level as well, so that people can understand that. And for example, the Good Day at Work survey, did flag a couple of areas where we were worried about people, and we've looked at the occupational health data, and there is some increases in sickness absence in those areas. So we have a plan now of what we're going to do to try and go in, do some focus groups, so qualitative groups where you sit down with people and you say, if you're able to, can you share what you're worried about, and we can then start to make meaningful change in that area. So again, it's that ability to spot hotspots, spot what's going wrong. It was really interesting when we did the first Good Day at Work survey in 2022, because I really felt at the time from the patients I was seeing that we might see some work overload issues, and it was absolutely completely different. It was people feeling not engaged, and it just goes to show you. So as a doctor, I try and give the business qualitative insights from the patients I see if I feel like I'm seeing a trend, but equally I'm only seeing a very, very small percentage of that business unit. So what I think might be a trend isn't really a trend. So again, very, very useful to get that wider data so you can address all your bits of information and decide which bits are going to be the important ones.
Yeah, and I think it all has its place, doesn't it? I think sometimes overlaying that qualitative piece on top of the quant is really important as well, because you understand the business context, you understand those things that wrap around it. So I think, yeah, they both have the place. But I think the kind of big thing that's coming through from what you're saying there about the dissemination of the data and putting it into the right hands, at the right level as well, in terms of not overloading the data, but in a way that is understandable and translatable, can be really impactful. And I think that's the big thing, isn't it? Actually, it's not just about collecting more data, it's about doing something with it. It's about actually showing that you've had an impact and you've changed something because of it. So I think that's kind of one of probably the key things, and showing your employees as well that that's happening. So it's not just a barrage of questionnaires after another.
This comes from Ben's point, isn't it? You have to have a strategy, not a plan. A plan
Yeah.
would be do the survey.
Yeah.
End of. A strategy is do the survey in order to understand where your stresses are in your business, and then implement change to see whether that makes a difference. And again, a lot of businesses, they tick the box of they're having a look-see, but they don't allow adequate time and resources for people to follow up and create the strategy after, or the plan after, and that's really important.
Especially before they then survey again and expect to see a difference. It's like...
Well, I think people listening to this will be really struck by the difference between this and the sort of traditional engagement survey approach, because a lot of the measurement that's done inside organisations still comes through that route, and to a large degree, it is generally about, well, yeah, you are going to get some data for your area, but okay, here you go, here's the results, go and sort that out in line with some broader organisational goals or KPIs. I think what I can hear when you're talking about it is that is a world away from that. Firstly, because it's not just 2 or 3 questions about health and well-being that tick that box and say, well, we need to improve it, but how? So you've got the levers part, but also because you're supporting them to make that change and take those actions as an organisation. It cannot be that the sum total of the support that people are getting is here's what the problem is, go and sort it out. And I think we know obviously from working from you guys that you just don't see it that way, but you started somewhere with it. It's taken that strategic approach in many years to get to this, and having the culture that supports that. So in a way, I feel like it's a a really good marker for people, a really good thing for businesses that are less mature perhaps in this space to aim for as an outcome?
I think the other thing is, when we've chatted about this a few times, but well-being is, it's not something you just pick up and you have no knowledge of it. You don't need any knowledge of it. There is a lot of evidence base that you need to take the time to read and understand. And I was very lucky in nuclear operations, the group that have done this survey, because their head of wellbeing actually has a psychology background, and so Kim Cull has been instrumental in helping me to explain to the business why it's important that we take an evidence-based approach, and why it's important that the senior managers need to take a little bit of time to read and understand wellbeing. It is a science. It's not pink and fluffy. Well, it is sometimes pink and fluffy, but there is a science behind it, and you need to understand that evidence base. And I think I get frustrated when I hear people talk about wellbeing, and they're doing it, they're on top of the 20 other things that they do. They have no time to read about it, and then they don't, they have no idea what they're doing. They haven't read the Stevenson Farmer report. They haven't read, any of the kind of validated stress survey stuff, and so for me, if anyone's listening to that that's in the position, where they haven't done that research, really get out there and start reading about these things, because there is an evidence base and we need to act on the evidence base. What I love about you guys is you're willing to help us push those boundaries, because actually the evidence base isn't complete and there's lots of unanswered questions, and the Good Day at Work survey is a really good data set, if nothing else, to help us start to explore, like we talked about, how we can predict how can we predict who's struggling. Can we look at it? What can we derive from that?
We talked about this, Sarah, I think quite recently, but I think it is an important conversation that, we've talked about what wellbeing is, and it's been pink and fluffy, it's been this, it's been that. It is still relatively new in terms of corporate life, isn't it? Let's not forget. It's yes, it's not necessarily something that we have to keep proving in terms of why we're looking at it, but it is still relatively new, and with that comes the new roles around the area, and we've seen a lot of different job titles and roles coming out through different organisations. And yeah, I think there's definite risk, I think, isn't there, in that sense, that, well, like you say, people are either doing it on top of other roles, which isn't ideal, but obviously that is sometimes the case, but more and more just that there isn't really that standard yet, I think, or agreed standard or consistency in terms of background training and that sort of thing. So yeah, it's definitely something, isn't it, that's kind of out there at the moment as a challenge.
And it's a different take on investment, I think. It's investment in the health and well-being. People think, well, are you investing in external providers to help you drive excellence in health and well-being? And of course, we are in that space. But actually, the first investment is about having the right people who can own it for you internally. And what so many organisations, it's talk about organisations that are traditionally strong in health and safety. Often they're being asked to broaden their remit and take on wellbeing, but without any support to do that, or without any experts or people, as you say, Sarah, who've got the time to look into it properly. Now, you have a different take on it at EDF, and I think that's a really healthy thing. But that is a conscious investment. That's not something that's just happened by accident because you happen to have these clever people sitting around the organisation. It's been crafted to create that, and I really think that's an important thing.
I think the other thing we see a lot in wellbeing, which I really struggle with, is the amount of money that companies spend on wellbeing initiatives that don't work. And the recent CIPD review, of mindfulness, resilience, kind of the Cochrane review of mental health first aiders, which shows, there's no evidence that they decrease workplace, mental health or decrease mental ill health. Although I do think they raise awareness of mental ill health, so I think they have a place, but it's not in the way that perhaps the concept was first marketed. And I think, for anyone listening to this, have a really good look at what your company's buying in, because, investment is, you want a return on investment. You want something that's going to make your workplace a better place to work. And if you're buying in something that has no evidence base, I would look to consolidate and move towards something that really will make a difference. So manager training, for example, if you look at, a lot of the return on investment papers that have been done on wellbeing, there's clear ROI on manager training, looking at your culture, obviously measuring your, kind of occupational stress levels. The other aspect is the regulatory one, which is, I don't think, I think the the way that the regulator, the HSE, approaches workplace wellbeing is going to change in the next few years. So we, at the moment, if you break your leg at work, there is an investigation. It's quite a significant event. Whereas if we have somebody who becomes mentally unwell because of work, actually there isn't anything that happens as a result of that. And if you Google HSE, when should I report occupational stress cases, they only want to know if there's a cluster of them, not when there's just one, whereas actually with a workplace accident, they would look into it. I think their 10-year strategy is clear that they want to look at reducing work-related ill health. And I think given that the biggest bulk of work-related ill health is in the mental health space, you don't have to be a rocket scientist to know that the attention is very quickly going to turn to that, especially when we're operating in a climate where the health service can't cope with the mental ill health burden.
The emphasis on risk assessment is definitely coming, isn't it, from the HSE?
Yep.
There's absolutely no doubt that is going to, well, it already is in conversations that you have with practitioners in that space. It's changing the landscape, and it's changing what people are thinking about, and it's changing the plans that organisations are putting in place. It just hasn't hit yet, but it has changed practice already in the planning.
I mean, a lot of where the legal aspects of kind of mental health in the workplace is exposed is in employment tribunals, in terms of whether reasonable adjustments have been made, whether somebody who had already experienced occupational stress, it was foreseeable that they would experience it again. A lot of the legislation or the case law is around the employment tribunals, but I do think the regulator will be looking to apply higher standards to what's expected of workplaces, and again that's where wellbeing stops being pink and fluffy pretty quickly and gets into the corporate risk arena, and that's something that companies need to have on the radar.
We're hearing it both through the client lens, but also I think from out and about at the conference circuit at the moment, I think HSE are definitely putting that agenda forward and making it clear that we're moving more to proactive and knocking on the door, asking where it is, rather than waiting for you to, like you said, kind of report something.
Well, it's come full circle, hasn't it? It's in the 90s. It was all about stress audits and avoiding tribunals. And that's where all of the sort of the kernel of this more proactive and preventative approach to health, safety, and wellbeing came from. But then it's gone much more the other way, and much more the positive health and wellbeing, which is a great thing, and more about connecting it to business level outcomes and making it a real kind of important part of the business strategy, a board level issue, if you like. But actually, what this is doing is it's sort of reminding everybody what underpins that, and it's bringing that sort of that tough sort of underbelly that you can't get rid of and you can't ignore, back to people's mindsets, I guess.
But also we're in a challenging recruitment climate, aren't we? We've got more young people out of work than ever before because of mental health. We've got an ageing population. In occupational health, we've been planning for years, the fact that people are going to have to work longer. Ill health retirement doesn't really exist anymore in the way that it did. So human resourcing in companies are going to be really challenging. Now, if you're well looked after and you feel like your company is going to look after you, even if you're overloaded, even if you fall over, you're much more likely to stay, and you're more likely to advocate for other people to join that business. So wellbeing is going to be a key strategic aim of many businesses if they want to be able to recruit. If you're seen to look after people, you will have that strategic edge. If you're not, you'll very quickly struggle with your human resourcing.
Okay, I just like to move us on to a kind of slightly different subject. I mean, it's not totally different because it's coming from the data, but I know it's an area that that kind of you're quite interested in, Sarah, as well in EDFR, and it came from I guess the next discussion point that we're going to talk about is presenteeism, and just as a little bit of context for the listeners, EDF actually challenged us. They laid the gauntlet down when we've obviously, like you say, worked together, and one of the measures that we measure inside the Good Day at Work survey is presenteeism, and the more traditional kind of definition around presenteeism is coming to work when you're unwell or working whilst you're not well enough to perform the tasks of the function of your job. And I think there's been lots of information bandied around, hasn't there, and lots of figures and numbers and very frightening stats about the negative impact that presenteeism can have on businesses, and how it's even worse than absenteeism, and it's worse than all sorts of, and I think that, again, quite a fairly new concept in terms of what it was, and we were relying on some kind of, early what we thought was, early research and early data, I guess, in that area. And I think between us kind of thinking, can it be really that bad? Can these numbers really be real? And also EDF having a similar view, but also saying, come on, what does this actually mean? Can we actually look into this a little bit in terms of your wider data set that you have and the kind of research stretch that we have inside Robertson-Cope, because obviously it's really part of our underlying approach to what we do. We set out to kind of look at that, didn't we? So I just wondered if you wanted to just kind of introduce that from your perspective in terms of why EDF got quite interested in it.
Yeah, so when you're sitting in a boardroom and you're trying to explain to a business why mental health is important, one of the key kind of studies that changed the way that mental health was viewed by UK PLC was the Stevenson Farmer report, which I can't remember, was it 2017 or something like that? And it basically said that mental health was costing, I can't remember the figures either, a huge amount of money to British businesses, and the bulk of that cost was in presenteeism. And when you said that to board members, it just did not land. So the Stevenson Farmer report estimated that the cost of presenteeism was about 5 times that of absence. And when you presented it at senior level, it didn't seem right. As a scientist, you just think that just doesn't feel right, doesn't feel the right ballpark. Now, certainly when I think about my career, I have worked many times when I've been unwell, and the NHS would fall over if people didn't go to work when they were unwell. And all the times that I did work unwell, nothing bad happened, and I didn't take a risk and all the rest of it. So it didn't chime. And because it didn't chime, we were struggling to understand the importance of presenteeism to the mental health picture. We know it's not all about absenteeism, but we also know that presenteeism isn't all bad, because of the way in occupational health we use presenteeism, if you like. We put people back to work slightly earlier in graduated return to work, so that they dip their toe in the water of the workplace, see how it feels whilst they're getting better, and it can be a really effective form of rehabilitation.
That's a fit note, wasn't it, in terms of that shift towards actually what you're fit enough to do rather than what you're
not able to do.
Yeah.
And then, obviously your work on presenteeism, has really helped shift the lens on that. And I think that's really, really useful, because we're starting to get to the point where we can potentially see, that there may be a predictive element of presenteeism for absenteeism. And we can start to look at the markers of who's at risk of that, and how can we tell who's at risk of that, which is huge, really, isn't it?
Yeah, I mean, I think we shared a certain amount of unease, didn't we, about you coming from a in practice element, us coming from seeing lots of organisations talking about it and having that connection to the research. There was a definite unease about what the numbers were, because as you say, there's that 5 times. I think it's one of those, it's weird, isn't it, that things just get stuck in the collective narrative. 3 times, 5 times. I remember right all the way back to the the stuff that Kerry did in the Foresight programme in the probably like the noughties. And that was the first time I saw presenteeism compared with absenteeism in terms of costs, and it was 2 or 3 times back then. And I think it's sort of grown from there. We actually, as part of that work, we looked at the back to what the references were for those kind of figures, and it all stemmed back to one study that has just become generalised into the collective narrative. And it when you actually looked at that study, it wasn't even really presenteeism. I think it was about the ability to focus whilst unwell or something like that. But it certainly wasn't this definition of making a decision to work whilst unwell that's going to be damaging to you and reduce your productivity. So I think that was the spur for us. But obviously we were really listening to what you guys were saying about, well, we don't trust our numbers on it. We can't really do anything with the numbers on it. So what's the point? But actually, you're not saying that there isn't a point to it, because it is a real thing and there is a real problem. How can we open that out? And obviously, what we ended up doing was looking more at this concept of working whilst unwell, of which there are three different types, only one of which is presenteeism and only one of which is truly damaging, which I think is a really big shift for people in terms of thinking about that.
I was just going to say, it's a big cultural change, isn't it? Because, I remember certainly when I was a junior doctor, you would be expected to work even when you were really significantly unwell, and culturally it was a good character trait to have, to be able to work while unwell. And it's a really hard decision, isn't it? I'm sure we've all had it where we've felt unwell and you've got big meetings that day and you're sat there in the morning going, do I go? Do I not go? What do I do? And I think, where your kind of findings really move the story on is that we need to start to give employees some guidance as to when is it working whilst unwell and when is it presenteeism, and what kind of things do they want to think about when they're making those decisions. Because what you don't want is somebody who's really not well and has got presenteeism making a mistake at work or causing an accident at work, and that does happen, of course.
Absolutely. And I think as well as employee decision making, it's managers as well, isn't it? It's helping managers have that conversation ability, like to ask the right questions, to have the three different types give managers, I believe, a much better quality conversation to have with employees. Because absolutely, it's the employee's decision to make, but I think a manager will have responsibility, won't they, in this area, to be managing their team's well-being and making sure that those decisions are being made. So I think, to Ben's point, I think having that old figure of presenteeism, the whatever it was, and the 3 times and the 5 times, and the impact that it was having, wasn't enabling us to do anything about it. It wasn't enabling us to take it anywhere. And I think breaking it into the types gives us the kind of the understanding about, actually, it's not all going to lead to ill health or risk or lower productivity, because like the therapeutic type, for example, therapeutic presence, we can all probably sit back and think of examples where we've done that, actually, because it's been better for us, but for our own sense of well-being and health to get that thing done and then go and have a rest, or then take the rest of the day off. And I mean, I think the other big thing that's environmentally here that's happened here is obviously COVID, in terms of the kind of global pandemic has shifted all of this, and I think kind of really, I guess, made this even more relevant, hasn't it? Because the lines have been so much more blurred between work and home during that period, and now even still, but also I guess kind of and that kind of could have really massively, or it has massively complicated that in some respects. People talk, don't they, about the burnout and about not being able to put the work down and all those sort of things that come with it. So I guess it's the timing of it as well is probably quite important.
I think it's also increased functional presenteeism, in that going to the office when you feel unwell is quite hard, but actually if you can sit at home and write a few reports, that's probably much more manageable. And after the Stevenson Farmer report, all presenteeism was seen as bad. So we would see situations where, somebody would be sat there kind of not feeling great, and the manager would be ordering them to go home because, well, the usual reason is insurance doesn't cover you, which is quite a funny one. But, actually damaging the relationship potentially between the employee and the manager, when actually what we now know is they were probably functionally present and that was probably fine. And so again, it helps move that discussion along a little bit better, rather than seeing all presenteeism as bad, which did not feel right at all. And it meant that when you're there as the SME trying to talk about mental health and you're saying this is the cost of it, it makes it, if it's not believable, then all the other arguments you've got about why they need to invest in whatever they need to invest in are out the window. So it was losing us credibility quite significantly in this area.
And I think what it does is having 2 types of functional presence, if you like, that are okay, and not doing, not reducing productivity massively, particularly in the case of pragmatic presence, but definitely either not doing any harm to the employee long term or leading to long term absence, or actually in the case of therapeutic presence, making them better, helping them to recover. What it does though, having that versus the third category of true presenteeism, where people are too unwell to work and it is going to make them worse and it could lead to long-term absence, making that differentiation explains, it helps us to understand what's going on with those numbers. Because as you were saying, Sarah, if you're basically taking 2 types out of the overall number, of the overall count, and leaving what will be a smaller number. So actually I honestly think that the majority of numbers that people have in organisations, incident rates for presenteeism, are vastly inflated. They're nowhere near as high as because they're including the other 2 functional types in it as well. What that means is you're actually going to have a smaller true presenteeism group, but everybody in it is going to truly need support. They're going to need a different type of support to the support that people in the functional group have. Because in the functional group, you need to make sure it doesn't tip over and turn into dysfunctional presenteeism. You need to keep them there. You need to make sure that if they are feeling like they need to take sickness absence, they eventually take it, and you need to make sure it isn't damaging their health. But on the presenteeism side, everyone in that category now in true presenteeism needs support, because the research showed that actually, even in that category, under 5 days of it doesn't really affect productivity. If you go over 5 days, then it really does. It drops off like a stone, and it can turn into long-term. Probably will turn into long-term absence. So I think it's just an entire paradigm shift, and it's a big thing because, as we were saying before, based on very little evidence, it's actually really deeply ingrained. The traditional understanding, let's call it, of presenteeism is really deeply ingrained. That it costs loads, but no one can do anything about it.
And of course, when we're talking about kind of understanding safety risks, because this is where it starts to be really kind of hard hitting in the workplace. If you're looking at the whole group of the old model of presenteeism and correlating that with safety risks, you probably won't find a correlation, because 2/3 of that group are functional. When we start to refine it to people who truly aren't functional at work, because they are unwell, I think the safety risks will be much more evident. And that's really where I'd like the research to go, is to start to look at what are the safety risks, but also what things can we do to identify these people who are dysfunctionally present, in a positive way, in a positive supportive way, not in a punitive way.
Nuclear ops have started using the measure, so we've actually taken the research that we did and turned that into a new measure on the Good Day at Work questionnaire. And obviously nuclear ops and nuclear services have done that quite recently. I know it's very early days, but do you have any kind of thoughts in terms of what that might enable, or how you might take that forward?
For me, it's the safety piece, isn't it? That's the real bit I'd like to be able to look at, is of the people who had true presenteeism, dysfunctional presenteeism, what are the safety risks in that group? And then the bit about you can manage it for 5 days. Wouldn't it be great if we did something that meant that if you're in the first, if you're in the beginning of those 5 days, you flagged somewhere, so we could, actually put support in place at that point. So a lot of work left to do. I think one of the challenges, when we talked about this a while ago, but because the Good Day at Work survey is anonymised, we can't correlate those data with other external data that we have in the company. That makes it slightly challenging to move this forward. So whether we need to get on an experimental footing then to look at, where people volunteer to be part of an experimental group where we look at things, but to actually move this forward, it's been, it's presenteeism has been stagnated for 7-8 years, not feeling right. We're now moving it forward again, which is great.
It's great, the innovation piece. That's why we love working with you guys, because the innovation piece and being willing to look at it as both, it's actual work and it's actually happening live in the organisation, but it's also that research orientation. What having kind of engaged with the research and the ideas around it, and then started to apply it, what would you be saying to kind of other businesses about how they can start to change their thinking on this? Because like I say, I think it's quite a long road to travel, but also there's not much happening with what most organisations are doing right now.
It's like everything, isn't it? If you want to understand your presenteeism and what that means for your organisation, you have to measure it. You have to know, what does that look like for your organisation? We know, for example, that people who feel very invested in their job role, feel real sense of purpose, are more likely to have presenteeism. And I don't know whether that translates to dysfunctional presenteeism, but for example, NHS type organisations, where there are patient safety risks, understanding presenteeism in your organisation is going to be absolutely key. So measuring it is the start of everything. In my head, where would I like to get to? I'd like to get to something that employees do when they log in or tip up for work in the morning that gives you an indication of whether they're in that dysfunctional presenteeism group, so you can pick them up at the turnstile and go, right, what do we need? Let's get some help in. And that might be in the form of occupational health support, or it might be things like, if people, for example, are struggling with caring responsibilities, and that's forming a big part of why people are struggling at work, the organisation may want to look at its policies around that. So, understanding your employment group and what the challenges are with absenteeism and presenteeism will help decide where you need to go next in terms of interventions or support. and it'll be different for each business probably.
There's a big manager capability piece around that as well, isn't there? Because
Yeah.
the conversation that managers are currently having around absence, and probably to a lesser extent presenteeism, will be a certain way. This way of looking at it would be a different way, and it's there's definitely a learning piece for those guys as well, and needing to support that, being really clear on what their role is in relation to that.
I mean, the other thing about absenteeism is obviously, there are so many factors that influence absenteeism. And one of the factors is, we talked about it briefly, but GPs and fit notes. When I was a GP, we're not the right people as GPs to fill out fit notes because I'm there to look after my patient. And actually, if that patient's telling me they need sick leave, on the whole, most GPs, will look after their patient. So the whole issue about fitness for work and managers, patients, doctors understanding fitness for work, where the decision on fitness for work should lie, is all going to evolve in the next few, months, years. And I think that's going to be very an interesting journey as well, because when you've got a country like ours where we've got such high levels of worklessness due to ill health, where the fit note hasn't really been used in the way it was intended, as looking at what kind of adjustments can be made to work, it's not working, so they're going to have to look at something else. And with my specialty, you can't be a good occupational physician if you don't understand the work. You have to go into the workplace, you have to see what they're doing, what hoses they're lifting, what valves they're turning, because you can't recommend adjustments unless you've done that. So I think it's an exciting time, and understanding how that well-being, decisions on presenteeism, decisions on absenteeism translate into those big numbers is going to be really, really interesting.
Agreed. It's been a really interesting area to work on with you. So yeah, we've said it before, but thank you again for the challenge, because I think we were, as Ben said, there was some questions definitely there, but it really helped to have to partner with EDF to kind of look into it. And it's great now that you're actually, it's not just about talking about it, is it? As always, it's about, let's use those insights and that research to actually turn it into something and do something with it. So we're really excited to see what comes next. And I've written down all your ideas about what you're going to do there. So thanks for that.
That'll be the next challenge.
So we just got some kind of more general, questions to kind of close out the discussion a little bit. Because would you believe we've been talking for an hour and a half? It just flies, doesn't it? But I know, yeah, conscious that we want everyone to have a good day at work, so we don't want to drain everybody too much. But yeah, just one of the questions that we had. We've obviously heard that you were in the army, you served in active conflict zones, and you've seen very different days at what a day at work looks like to most people. So yeah, just interested if you can kind of tell us what unites a good day in kind of that life and this life, and what's different. I mean, we touched on it a little bit before, but just whether you had any reflections on that.
Yeah, I mean, sense of purpose is really significant, isn't it? If you feel, however awful a day is, if you feel that there's a reason that you're doing what you're doing, and when we think about Iraq, we were in a dressing station quite far forward, in the conflict. And the beauty about being an army medic is you treat patients on their patient need, not on whether they're in your uniform or someone else's uniform. And so that sense of purpose, that sense of preservation of life, that sense of camaraderie of working together to try and make sure that as many people recovered well from injuries, etc., was really important. And I think that's no different in the workplace today. It might not be an acute problem, but in terms of occupational health, looking after the people that work for you in your company, and making sure that they do come out of work well and healthy, and ideally come out of work better than they went in, is really important for feeling like you've had a good day at work and feeling like you've achieved that. But also, the team around you, the people you work with, feeling that they trust you, that you trust them, that you have that working relationship is absolutely key for me. If I didn't have that, I think I'd struggle really to motivate myself. That is absolutely what drives me.
Agreed. Same for me. And just a little bit more of a kind of personal one, I guess, in terms of like you're in obviously a really senior role, and I've met you and worked with you and seen how busy you are, and you're flying around from here, there and everywhere, aren't you? Whether you're in the office or out and about in different locations or on speaking platforms and spreading the word, because you're really committed to the whole agenda. So I know that you do a lot of traveling, a lot of juggling. So how do you kind of personally manage those pressures, and how do you balance that kind of the flexibility, the boundaries of work and home life and all that sort of thing. So I think, sometimes listeners, it's nice to get that kind of more personal insight into how you do it. A lot of senior leaders obviously don't always share either. So I think it's quite nice sometimes to hear about how you personally do that.
So anyone who's heard me speak will know that I swear by the stress bucket. So know your stress bucket, know what's in it, know how full it is, and constantly monitor that. So when I was doing my PhD, I was quite heavily pregnant with baby number 2. Husband was in Afghanistan. Baby number 1 was 22 months. I was in a really busy army headquarter
I'm stressed
role.
already thinking about that, Sarah.
And I definitely had bitten off probably more than I could chew, and I very quickly learned that on a daily basis I had to think, where am I? Because I'm a bit of a yes person. I'll always try and help people, I'll always try and take up kind of extra challenges, but I had to learn to say no sometimes, and that was really, really tough for me. But the stress bucket is my stressor meter, basically. If I'm feeling like, overloaded, like I can't get on top of things, like my to-do list is not achievable, I know I've got to cut something out. And in terms of family life, I think it's talking to your family and being really open with your family. And I always say to them, tell me if it's too much, tell me, if this is not manageable. When I took the job, interestingly, because when I was leaving the army, this job involved a move from near Winchester up to Cheltenham, and so we actually sat and had a family meeting about it, because it was a really big deal. The kids, I think, were like 5 and 3 or something. My mum was moving with us, so we sat and played out all the pros and cons. So I think your family have to be with you on the journey, don't they? They have to be happy with what you're doing. And ultimately, the army used to have a mantra of, the needs of the service must come first, but I don't agree with that. I think if you do that, invariably that leads to distress and problems. And actually, if you look after your family, quite often the business will do well as well, because you'll be in a good place and be able to work. So communication, stress bucket, be honest with yourself when you're struggling. Don't try and do everything.
Yeah, and having that family there and those family and friends there to sometimes to bring it to your awareness as well, because when you're in deep in the stress bucket, sometimes it's hard to see, isn't it?
Yeah, so, absolutely.
Yeah, and just finally, then, this is the all-time question: what would be? You've given quite a bit of advice, to be honest, and pointers and learnings throughout. But if we were going to say, what was your one piece of advice for health and wellbeing practitioners, in organisations that might be maybe a couple of steps behind EDF, because you're quite kind of advanced, I think, in your approach. But would you have, if you just got one kind of, it's not a magic bullet, I know, but if you had one piece of advice that you could give, what would that be?
Ooh, one piece. I've got about 10.
I
think the one that I don't, I know. The one I don't get the most is that you find a lot of organisations who have health practitioners, who have nurses, cut them out of wellbeing, and that's barking, because ultimately, mental health and wellbeing is exactly what occupational health do. So if you have health assets, make sure that you loop them in, because quite often they will know the evidence base, they will have all of this to tap. And what makes it so powerful at EDF is that it's not a health lead, it's a wellbeing lead, but they tap into everything we know. Our ROC health nurses give them the qualitative insights. It is a joint effort, because don't ignore the specialists that you do have is the bottom line. Good
point. Very good point. Yeah. Well, thank you so much, Sarah. We've thoroughly enjoyed our conversation, and we know that our listeners will find that really helpful, really interesting. So thanks for joining us, and have a lovely rest of the day and weekend when it gets here. Thank you so much for listening to the Good Day at Work podcast, brought to you by Robertson-Cooper. If you enjoyed this episode, be sure to subscribe, like, and leave a review. Every time you do, it helps us to promote our podcast and increases the chances of others finding the show too.
For further details on Robertson-Cooper and how our science-based products deliver data-led, actionable insights that empower organisations to create more good days at work, enhance employee wellbeing, and support key business outcomes, head over to robertsoncooper.com. See you next time.